Welcome to the deep dive. Today we're tackling aortic thromboembolism, or AEE.
Right. AEE.
It sounds pretty technical, I know, but what we want to do is really pull out the essential stuff. What's most critical and, frankly, fascinating about this condition.
Especially how it hits our pets.
Exactly. Mostly cats, sometimes dogs. And it's serious.
Very serious. And, while it's maybe less common in humans in this exact way, studying it in animals, it actually tells us a lot. You uncover some surprising things about biology.
Totally agree. So our mission for this deep dive, let's unpack what causes these blood clots in the artery.
Yeah, where do they come from?
And who's most at risk. How do you spot the signs? Crucial stuff.
Definitely. And how vets figure it out, the diagnosis.
Right. And then what can actually be done. The treatments. We'll definitely focus on, the big differences between cats and dogs.
Because there really are some intriguing ones.
Yeah. Might make you think a bit differently about some underlying health problems. Okay. Let's dive in. Where does this clot, this dangerous thing, actually start?
So in cats, the link is super strong with heart disease, specifically hypertrophic cardiomyopathy, HCM.
HCM, right. Thickened heart muscle.
Exactly. And that thickened muscle, it messes up the normal blood flow.
Mm-hmm.
You get these areas, particularly in the left atrium, where the blood just kind of pools, stagnates.
Ah, okay. Sluggish flow.
Right. And you combine that sluggish flow with the fact that some cats, well, their blood just seems more prone to clotting anyway. It's a hypercoagulable state.
So bad flow plus sticky blood.
Bingo. Perfect storm for a thrombus, that's the clot, to form right there in the heart.
Makes sense. So the heart condition really sets the stage. Now, when that clot breaks loose, an embolus, where does it usually end up causing trouble in cats?
The classic spot, the most common one, is the caudal aortic trifurcation.
That sounds technical.
It is, but basically it's where the aorta, the big artery coming off the heart, splits to go down to the hind legs.
Gotcha. Like a Y junction.
Pretty much. And when a clot gets stuck there, bam, it cuts off blood flow to the back legs. That's what gives you those, classic signs of feline ADE.
Sudden paralysis.
Pain, exactly. But it's important to know, they don't always go there. Sometimes the clot travels somewhere else.
Oh, like what?
It could be a front leg, maybe the kidneys, the gut, even the brain sometimes.
Wow. So it really highlights how once that clot is loose, it can wreak havoc pretty much anywhere downstream.
Absolutely. It shows you the systemic potential.
It really does. Okay, so that's the picture in cats, strongly linked to the heart. What about dogs? Is it a similar story there?
Not quite. In dogs, the causes seem, well, more varied. ADE in dogs is often connected to other underlying issues.
Like what sort of things?
Things like cancer, serious infections, sepsis, or maybe infectious endocarditis, which is infection on the heart valves.
Okay.
Also, Cushing's disease or kidney problems where they lose a lot of protein. That's protein-losing nephropathy. Basically, conditions that make the blood generally more likely to clot.
A hypercoagulable state again, but maybe from different root causes.
Exactly. But here's the really interesting, maybe slightly puzzling part.
Oh.
A recent study looking at dogs with ATE found that in, get this, 58% of them, they couldn't find any other concurrent condition.
Wait, over half. So in more than half the dog cases, they didn't know why the clot formed.
Pretty much. No obvious underlying disease identified.
That's huge. That throws a wrench in things, doesn't it?
It really does.
Yeah.
It makes you wonder, are we missing something in dogs? Are there factors we just haven't recognized yet?
Yeah, could there be subtle things or maybe completely unknown triggers at play?
Absolutely. It strongly suggests our understanding, especially for dogs, is, well, still evolving. There might be mechanisms we just don't grasp yet.
Fascinating. Okay, so the clot forms, breaks loose, gets stuck, blocks blood flow. Let's zoom out a bit. What major body systems feel the biggest hit from this in both cats and dogs?
Well, given the starting point, especially in cats being the heart.
Right, cardiovascular seems obvious.
Exactly. The heart and circulatory system are definitely involved. You often find advanced heart disease, maybe even signs of left heart failure, in cats that get ATE.
Makes total sense. And then the really visible stuff, like the legs not working?
That's hitting the nervous system and the musculoskeletal system.
How does that work?
The blockage cuts off blood supply, right? That's called ischemia. Severe ischemia to the muscles and nerves in those limbs causes, well, intense pain and weakness, paresis. Or it can quickly become full paralysis.
So it's the lack of oxygen and nutrients from the blood.
Precisely. It damages those tissues fast. So whether it's a cat or a dog, if an artery to a limb is blocked, You'll see problems moving an abnormal gait, maybe dragging a leg, or complete inability to move it.
And it can happen really fast, you said.
It can be incredibly sudden, especially in cats. A real emergency.
Definitely sounds like it.
Yep.
Okay, this brings us to something vets often talk about, the 5 Ps. Can you break those down for us?
Yeah, the 5 Ps are a really helpful mnemonic, a way to remember the classic signs you look for with AE.
Okay, what are they?
They are pain, paralysis, or paresis. That's the weakness.
Right. Pain, paralysis, paresis.
Pulselessness, meaning you can't feel a pulse in the affected limb.
Okay.
Pallor of the skin, or paw pads, might look pale.
Pallor. Got it. And the last one?
Poikilothermic. Fancy word for saying the limb feels cold to the touch compared to the rest of the body or the other limbs.
Okay, so pain, paralysis, pulselessness, pallor, and poikilothermia, coldness. How do these typically show up in cats?
In cats, the big ones owners usually notice first are that sudden inability to move, often both hind legs,
Yeah.
and obvious significant pain. The cat might be crying out, yowling, very distressed,
Agitated, anxious.
very anxious, restless.
Mhm.
And because of the heart link we talked about, you often see breathing changes too. Fast breathing, tachypnea, maybe even struggling to breathe if they're in heart failure.
Right. Respiratory distress.
Yeah. And here's a slightly weird one. About 15% of cats might actually vomit shortly before the main event.
Vomiting before the leg paralysis. That's unexpected.
It is. It's not something you'd immediately link, but it could be an early warning sign. Might get an owner to the vet just before the really dramatic signs hit.
Huh. Definitely good to know. What about dogs? Do they show the 5 Ps in the same dramatic way?
They can, certainly. All those signs can be present, but the typical story in dogs can be a bit different.
How so?
Instead of that super acute, sudden paralysis we often see in cats, dogs might present with more of a lameness. Or maybe a gait abnormality like stumbling or weakness. That's actually been going on for, say, several weeks.
Oh, so more gradual.
Sometimes, yeah.
Yeah.
A more chronic or subacute onset. You can make picking it up initially a bit trickier sometimes, compared to the classic screaming cat that can't move its back legs.
That's a really important difference between them. Okay, so an owner sees these signs, brings the pet in. What's the vet thinking? How do they confirm it's ATE and not, say, a back problem?
Yeah, that's crucial. It's all about differential diagnosis, basically, making a list of possibilities and ruling things out.
What else could cause similar hind limb signs?
Spinal cord issues are a big one. Things like a slipped disc, maybe a spinal tumor, trauma to the spine, inflammation, even something called an FCE, a fibrocartilaginous embolism, which is like a blockage in the spinal cord's blood supply.
Okay, so how do you tell the difference between a spinal problem and ATE?
The neurological exam is key. There's a distinction between what we call upper motor neuron signs and lower motor neuron signs.
Okay, technical terms again. What does that mean practically?
So spinal cord injuries often cause upper motor neuron signs below the injury. They increased muscle tone, maybe exaggerated reflexes initially.
Right.
ATE, blocking the blood supply directly to the nerves and muscles of the limb, typically causes lower motor neuron signs in that limb. So you'd see decreased muscle tone, flaccid paralysis, reduced or absent reflexes, maybe muscle wasting later on.
Okay, that neuro exam points you in a direction. What about blood tests? Do they help?
They do, but maybe indirectly. Blood work can show the consequences of the blockage. We often see really high levels of muscle enzymes like creatine kinase, CK, and also liver enzymes like AST and ALT. They leak out from the damaged muscle and potentially liver tissue starved of oxygen.
Okay, signs of tissue damage.
Exactly. Stress alone can cause high blood sugar, hyperglycemia, and you might see mild increases in kidney values, BUN, and creatinine.
Why the kidneys?
Could be from overall poor blood flow from the heart, low cardiac output, or maybe tiny clots went to the kidneys too.
Right.
You could also get electrolyte shifts, things like low calcium, low sodium, high potassium, high phosphorus, again, due to poor circulation and muscle breakdown, releasing stuff like potassium.
So the blood tests confirm there's significant tissue injury happening consistent with AD, but they don't definitively say it's a clot.
Precisely. And here's another interesting bit. Standard clotting tests, the ones like PT and PTT that check the general clotting cascade. Often, they're normal.
Really? Why is that?
Because the main problem in many 8 cases isn't the whole cascade. It's often about the platelets being too sticky, too ready to clump together. Hyperaggregable platelets.
Ah, so the standard tests might miss that specific issue.
They often do. In dogs, there's a more specialized test, thrombolytics or TAG,
Yeah.
that might pick up on that hypercoagulable state, but it's not routinely available everywhere.
Fascinating. So blood work gives clues, confirms damage. What about looking inside? Imaging, x-rays, ultrasound?
Yeah, imaging is super important. Radiographs, x-rays, especially in cats, can tell you a lot. Remember the heart link?
Right, HCM.
So on x-rays, you might see an enlarged heart, cardiomegaly. And in about half the feline cases, you'll see signs of congestive heart failure fluid in the lungs, pulmonary edema, or around the lungs, pleural effusion.
So the chest x-ray points strongly towards the likely source in cats.
Very often, yes. Occasionally, you might spot something else, like a lung mass suggesting cancer, which could be the reason for the hypercoagulable state, but the heart signs are more common.
Okay. What about ultrasound, especially of the heart? An echocardiogram.
Echo is incredibly valuable, particularly in cats. It lets us look directly at the heart muscle, the chambers, how it's pumping.
What do you see?
You often see the changes of cardiomyopathy, like the thickened walls of HCM. A really key finding is severe enlargement of the left atrium. That chamber gets stretched out because of the pressure backup.
And can you actually see the clots?
Sometimes, yes.
Yeah.
You might directly visualize the thrombus sitting in the left atrium. Or you might see this thing called spontaneous echocardiographic contrast, which looks like smoke swirling around in the atrium.
Smoke.
Yeah, it indicates really sluggish blood flow, a high risk for clot formation. Seeing the clot itself or that smoke is, well, pretty definitive evidence.
Wow. That must be quite something to see. What about ultrasound of the abdomen? Is that useful?
It can be. You can try to look for the clot itself in the aorta, down where it splits. It tends to be maybe more useful in dogs for actually spotting the clot there.
And in cats?
In cats, you might see it. But the echo is often so revealing about the heart, the likely source, that abdominal ultrasound for finding the clot itself is maybe less critical for the diagnosis pathway.
Gotcha. Any super advanced imaging used, like angiograms?
Angiography, where they inject dye to see blood vessels, can show the clot as a filling defect. But honestly, it's usually not needed to make the diagnosis. The clinical signs, blood work, and especially the echo in cats usually paint a clear enough picture.
Okay, so you've put the pieces together. Signs, blood work, imaging. You've got the diagnosis, AE. What happens next? What's the immediate treatment?
First thing, these animals usually need to be hospitalized, especially cats, because they're often in heart failure, they're in a lot of pain, very stressed.
Makes sense. Intensive care needed.
Absolutely. Yeah. Things like oxygen therapy are vital if they're struggling to breathe. Careful fluid therapy, you have to be cautious with fluids if the heart is already struggling.
Right, don't want to overload it.
Exactly. If there's fluid in the chest, pleural effusion, draining that off with a needle, thoracentesis, can make a huge difference really quickly for their breathing. And just gentle handling, especially of those painful limbs.
Okay, supportive care is critical. What about medications to actually tackle the clot or prevent more?
Right, so there are a few categories. One is thrombolytic therapy clot busters, drugs like TPA, tissue plasminogen activator.
Like they use in humans for stroke.
Exactly. The idea is to dissolve the clot that's already there, but it's not used that often in pets.
Why not?
Several reasons. It's expensive. There's a significant risk of bleeding, which can be fatal. And honestly, studies haven't consistently shown it actually improves overall survival compared to other treatments in general practice.
So high risk, high cost, uncertain benefit mostly.
Pretty much. There's a thought it might be more helpful if you can give it super early, like within 6 hours of the clot lodging, but that's often hard to achieve.
Okay, so clot busters are tricky. What about stopping more clots forming or the existing one getting bigger?
That's where antiplatelet drugs and anticoagulants come in. They're mainstays of treatment.
Antiplatelets first, like aspirin?
Aspirin is one, yes. But actually another drug, Clopidogrel brand name Plavix, has shown better results in cats.
Better how?
Studies found Clopidogrel was better than aspirin at preventing reembolization, meaning another clot forming and causing problems later, and it improved survival times in cats who got through the initial AT event.
Okay, so Clopidogrel is often preferred, at least in cats.
Yes, usually started with a loading dose, then a daily maintenance dose.
Yeah.
Aspirin is still used sometimes, lower doses than humans, but can cause stomach upset.
Right. And what about anticoagulants? You mentioned heparin, warfarin.
Yeah, anticoagulants work on the clotting factors.
Yeah.
Slightly different mechanism than antiplatelets. Heparin is often used right at the beginning in the hospital.
What does heparin do?
It doesn't break down the clot that's there, but it helps stop it getting bigger and prevents new clots forming while the body hopefully starts to deal with the existing one. It's usually given by injection.
Okay, initial stabilization. What about longer term?
Warfarin is an option for longer-term prevention of recurrence. It's a pill, but It's tricky to manage.
Why is that?
It needs really frequent blood test monitoring, INR tests to make sure the dose is right. Too little, it doesn't work. Too much, and you risk serious bleeding. Getting that balance can be tough.
Sounds challenging. Any other anticoagulant options?
There are newer ones, like low molecular weight heparin, LMWH, drugs like enoxaparin or dalteparin.
How are they different?
They tend to have more predictable effects, so less intensive monitoring is usually needed compared to warfarin, and potentially a lower risk of bleeding.
Sounds good. Downsides?
They're generally more expensive,
Mm.
and they still need to be given by injection, usually once or twice a day by the owner at home.
Right, so pros and cons for each. It sounds like choosing the right anti-clotting strategy is complex.
It really is. Balancing efficacy against risk, cost, and practicality for the owner.
And we can't forget the pain. You said it's intense.
Oh, absolutely critical. Pain management is paramount. Strong pain relief is needed.
What kind of drugs?
Opioids are the mainstay. Things like buprenorphine, fentanyl, maybe hydromorphone, given regularly to keep the animal comfortable. Sometimes sedatives like esopromazine might be used carefully too for calming and maybe some blood vessel dilation effects.
So a multi-pronged attack, support the body, try to manage the clot, prevent more clots, and control that awful pain.
That's the goal, yes.
Is surgery ever an option, like physically going in to remove the clot?
Surgical embolectomy, yeah. It's generally not recommended.
Why not? Seems logical to just take it out.
The problem is the anesthetic risk. Remember, especially in cats, there's often severe underlying heart disease. Putting them through a major surgery and anesthesia is incredibly risky, often too risky.
Ah, the underlying condition makes surgery dangerous.
Exactly. There have been attempts with less invasive techniques like rheolytic thrombectomy, using devices to break up the clot, but success has been pretty limited so far. Medical management is really the primary approach.
Okay, so it's mainly about medication and support. Now, the hard question. What's the outlook? The prognosis after an AEE.
Yeah, this is the tough part. Unfortunately, the prognosis, both short-term and long-term, is generally pretty guarded to poor for both species.
Really? Even with all those treatments?
Even with treatment. In cats, the numbers are stark. Around 60% are either euthanized or die during that initial hospital stay.
Wow, 60%. That's incredibly high.
It is. It reflects the severity of the condition and often the underlying heart failure.
What about the cats that do make it through that initial crisis?
For those survivors, the long-term survival varies a lot. Some might only live a few more months, others occasionally, maybe even a year or two. But the average survival time, even with treatment, is typically just, a few months.
Are there factors that suggest a better or worse outcome?
Yes. Things that point to a poorer prognosis include being cold on arrival hypothermia and having signs of congestive heart failure.
And better signs?
Cats that maintain a normal body temperature maybe only have one leg affected instead of both, and still have some movement, some motor function in the affected leg initially. They tend to fare a bit better.
Okay. It's still a very challenging picture for cats. What about dogs? Is it just as bleak?
Well, we have less data for dogs because it's less common overall, but the prognosis is generally considered poor for them too.
Any nuances there?
There's maybe a hint in some studies that dogs presenting with those more chronic, gradual signs, if treated appropriately, perhaps with warfarin long-term, might have a slightly better outcome than the acute cases, but overall, still very serious.
And you mentioned recurrence is a big risk.
Huge risk. For animals that survive the first event, there's a high likelihood of another clot forming later. That's why the long-term antiplatelet or anticoagulant therapy is so essential. It's about prevention.
What other complications can pop up down the line, even if they survive initially?
Well, bleeding is always a risk with the medications. Permanent nerve damage or muscle contracture in the affected leg is possible if the ischemia was bad.
So they might never regain full function.
Correct. Recurrent heart failure episodes are common in cats, and sudden death is always a risk with severe heart disease. Also, something called reperfusion injury.
Reperfusion injury, what's that?
When blood flow returns to tissue that's been starved of oxygen for a while, the damaged cells can release harmful substances, like potassium and inflammatory mediators.
So restoring blood flow can paradoxically cause problems.
It can, yeah. It can sometimes trigger dangerous heart rhythm abnormalities or other systemic issues. It's less common, but a serious potential complication.
Man, it really sounds like managing AE is just incredibly complex and often heartbreaking.
It truly is. And that's why communication with the owner is just so important.
What do owners need to understand?
They need a realistic picture. Understanding the guarded prognosis, the very real risk of it happening again, the need for potentially lifelong medication, the costs involved, the commitment to monitoring, it's a lot.
Absolutely. Let's try and wrap this up. To summarize what we've talked about in this deep dive, aortic thromboembolism, AGE, is a really severe condition, blood clot blocking the main artery, cutting off blood flow.
Usually to the hind legs, but sometimes elsewhere.
Right, and we learned in cats it's super tightly linked to underlying heart disease, especially HCM, often presents really dramatically sudden pain paralysis.
Whereas in dogs, the causes are more varied: cancer, infections, other diseases, but also, intriguingly, often unknown. And the signs can sometimes be more gradual.
Recognizing those 5Ps, pain, paralysis, pulselessness, pallor, poikilothermia, is key for owners and vets.
Definitely. Diagnosis involves ruling out other causes like spinal issues, using blood tests to see the organ damage, and imaging, especially that echo in cats, to look at the heart.
Treatment is intensive. Hospitalization, oxygen, careful fluids, pain control, and then those crucial antiplatelet and anticoagulant drugs like Clopidogrel and Heparin. Surgery usually isn't the way to go.
Correct. And despite all that, the prognosis sadly remains guarded to poor, with a high risk of recurrence. Prevention in animals known to be at risk is really important.
It's a tough one. Which leads to maybe a final thought to leave everyone with.
Yeah.
Given these really distinct pictures, we see the strong heart link in cats versus the more varied and often unknown causes in dogs. What research could really help us here?
That's a great question. Like, what could finally shed light on why over half those dogs get ADE seemingly out of nowhere?
Exactly. And how could finding those answers for both cats and dogs lead to better ways to manage this long term? Better prevention, better treatment outcomes, improving quality of life.
Yeah. There's clearly still so much to learn to really combat this devastating condition effectively. Big questions remain.
Absolutely. Well, thank you for exploring this complex topic with us today. We really hope this deep dive has given you, our listener, a clearer understanding of aortic thromboembolism.